Social Democrats.
Minister, at the outset I want to just mention the programme last night, the primetime programme, which exposed really disturbing and shocking abuse and neglect of older people in some nursing homes. This is an issue, Minister, that has been very well flagged for a long time. Last year the COVID committee raised serious concerns, the expert group, SAGE advocacy, the care champions. They have all raised these issues in relation to the maltreatment of older people. And there is an inquiry needed, but we know the key things that need to be done urgently, and we need action on those. And that needs to happen very quickly. And that is introducing statutory ratios for staff. Staff-resident ratios in nursing homes. It's shocking that they don't exist. And obviously HICWA need to be given greater powers as a regulator. And they're two things that should happen urgently. And I'd ask you to take action on that. The fundamental problem, of course, is the privatisation of nursing home care for older people and care for older people generally. And that's a major issue where nursing homes are seen as good investment opportunities rather than essential elements of the care service for older people. So we need urgent action on that, Minister. Look, in relation to vaccinations then, I join with others in thanking and commending the staff from the HSE, GPs, people who volunteered as vaccinators, pharmacists, all of the people that really stepped up in relation to rolling out the vaccines as quickly as possible. The system has been absolutely fantastic, and somebody who has both experienced it firsthand and also spoken to a lot of people, there's nothing but praise for how the system is working. It's been really successful, and more demands are going to be made on all of those people in the coming weeks, and I'm very confident that they have the capacity to do that, and there's great willingness, and I think the public has responded extremely well. I would just make a couple of points. I think a lot of the pharmacists have been blindsided, and I'm getting reports this morning of, there's a big rush to contact pharmacists to find out when people can get access to the vaccines, and pharmacists haven't been told about what their deliveries are likely to be. Many of them have run out of vaccines at this stage and don't know when they're going to get new deliveries. So it's really important that that message gets out to pharmacists as quickly as possible in relation to what they can expect, because they're very keen and willing to participate fully, but they need to know what the supplies are going to be. The other point I would make, Minister, is in relation to public health messaging, and that has been quite weak over recent weeks, and I think there's a need to now put a new focus on that. And obviously the whole question of the importance of vaccinations, we all have a responsibility in that regard, and I think all of us here have been putting out that message loud and clear. So that needs to be repeated, but we also, I think, need to make it clear to people in respect of the different vaccines about the waiting period after completing vaccination. And again, everybody's so keen to get back to some kind of normality and get out and about and so on. But I think it's very important to stress that waiting period. And it's not clear in relation to, for example, the Janssen vaccine, what that waiting period is. And I think we need to be much clearer about that you're not fully protected or protected to the maximum until you complete that waiting period. I also think there's a need for clarification about the level of protection which having had COVID gives to people, particularly in the context of the Delta, because we haven't heard much about that as of now. And also there isn't clear information to people who've had COVID and the different kind of periods. How long does it give you protection? A lot of people in that situation, and they need clarity on that. The other point about the general public health measures, they need to be repeated, but they also need to be refreshed, and particularly, I would say, in relation to ventilation. I mean, this is an issue that has been very much neglected by official sources. And, you know, the tendency is to talk about the medical aspects of this, and obviously they're essential. But there are also many practical and non-medical or non-pharmaceutical aspects to responding to this and ensuring public safety. And ventilation is a key one of those. We've had, you know, the expert group making recommendations, but those recommendations don't seem to have been taken on board and incorporated into the public health messaging. And for example, Minister, I would ask you to check the HSE website in relation to ventilation, because the information they have there is just not accurate. They actually say that there's no evidence to say that COVID is airborne. That just doesn't stand up any longer. That is an incredible statement that is on the HSE website. I checked it yesterday. That must be changed, and there must be clear guidance given to industry as well in relation to the important role of ventilation. And that can be as simple as having CO2 monitors. You know, and making those obligatory in business places. But also, you know, that has been taken on board by education now, and that's great. But there has to be clear guidance and standards set out there. I don't know why we're not doing that. And I'd ask you, Minister, to take that up in a serious way. The other question I'd ask is just about booster doses. What contingency planning have we made for those? And are there pre-orders in relation to that? And finally, I would just make the point in relation to older people, and Age Action have set out a number of requests in relation to queries and concerns of older people, particularly in relation to the over 60s. And, you know, the concern that has been expressed about the fact that they didn't get access to what they would see as the best possible vaccines. There needs to be clarification for that. And I'd ask for interaction with Age Action in particular and information being provided. Thanks, Minister. Thank you.